It is now my privilege to introduce our speakers for the next session. First, Jeremy Hanson Willis. Jeremy was appointed Chief Executive Officer of Rainbow Health in April of 2019. Under Jeremy's leadership, Rainbow Health has nearly tripled its annual budget with expanded mental and chemical health services, free teleprep and STI pharmacy, and aging programs for older LGBTQ plus individuals and people with HIV. Jeremy believes that Rainbow Health's legacy of fighting HIV for nearly 40 years can help fuel a sorely needed health equity movement in Minnesota. Jeremy has been named a 2021 Notable LGBTQ Executive by Twin Cities Business Magazine, serves on the Minnesota Health Equity Advisory Leadership Council, and has been featured in several local TV, radio, and print publications. Prior to joining Rainbow Health, Jeremy served as the Deputy Commissioner of Workforce Development for the Minnesota Department of Employment and Economic Development, or DEED. Jeremy also spent 9 years in various roles with the City of Minneapolis. Jeremy grew up on a farm in rural Ada, Minnesota. I'm from rural Wisconsin, and holds a bachelor's degree in communications, political science, and gender studies from the Catholic College, and was a Policy Forum Fellow at the Humphrey Institute in 1996. I'm also honored to welcome and introduce Dr. Jesse Ehrenfeld. Dr. Ehrenfeld was inaugurated as the President of the American Medical Association in 2023. He's our American Medical Association president, which is kind of a big deal. He is Senior Associate Dean, tenured Professor of Anesthesiology, and Director of Advancing Healthier Wisconsin Endowment at the Medical College of Wisconsin. He was elected to the American Medical Association Board of Trustees all the way back in 2014. Dr. Ehrenfeld has quite an impressive bio, and I'm going to give you some information about some of the things that he's done, but he's a really, really interesting person. Dr. Ehrenfeld divides his time among clinical practice, teaching, research, and directing a $560 million statewide health philanthropy. He also has an appointment as an adjunct professor of anesthesiology and health policy at Vanderbilt University in Nashville, Tennessee, and is an adjunct professor of surgery at the Uniformed Services University of the National Sciences in Bethesda, Maryland. Dr. Ehrenfeld is a consultant to the World Health Organization Digital Health Technical Advisory Group, and previously served as a co-chair of the Navy Surgeon General's Task Force on Personalized and Digital Medicine, and as a special advisor to the 20th U.S. Surgeon General. Dr. Ehrenfeld is a combat veteran who was deployed in Afghanistan during both Operation Enduring Freedom and Resolute Support Mission. Dr. Ehrenfeld, for his work in capturing and supporting the lives of LGBTQ plus people, was recognized in 2015 with a White House News Photographers Association Award, and in 2016 with an Emmy nomination. Dr. Ehrenfeld's research, which focuses on understanding how information technology can improve surgical safety and patient outcomes, has been funded by the National Institutes of Health, the Department of Defense, the Robert Wood Johnson Foundation, the Anesthesia Patient Safety Foundation, and the Foundation for Anesthesia Education and Research. He currently serves on the National Academy of Medicine's National Health Policy Fellowships and Leadership Programs Training or Advisory Committee. His work led to the publication of more than 275 peer-reviewed manuscripts. He's the editor-in-chief of the Journal of Medical Systems and has co-authored 22 clinical textbooks that have been translated into multiple languages. Dr. Ehrenfeld has received numerous awards for his research and is a recipient of several prestigious teaching awards. Born in Wilmington, Delaware, Dr. Ehrenfeld is a graduate of Phillips Academy, Haverford College, and the University of Chicago Pritzker School of Medicine and the Harvard School of Public Health. He completed an internship in internal medicine, a residency in anesthesiology, and a research informatics fellowship at the Massachusetts General Hospital. Board certified in both anesthesiology and clinical informatics, Dr. Ehrenfeld is a fellow of the American Society of Anesthesiologists and the American Medical Informatics Association. He just told me that he has been all over the country this week, in Louisiana and Ohio, and left Ohio early so that he could be here with us. And I think that makes me feel really proud that he saw that it was worth his time to come be here with us in the work that we're doing. Upon his inauguration, Dr. Ehrenfeld made AMA history as the first openly gay president of the American Medical Association. For the past 2 decades, he's been a nationally recognized advocate for lesbian, gay, bisexual, transgender, and queer individuals. In 2018, in recognition of his outstanding research contributions, he received the inaugural Sexual and Gender Minority Research Investigator Award from the director of the NIH. Please join me in welcoming Dr. Ehrenfeld.
Thank you. Thank you so much. Can you hear me? Is this on? Yeah. Great. Thank you so much, Dr. Reese. And please, let's give another hand for Dr. Reese. And we really appreciate you being here today and Rainbow Health's partnership with the Minnesota Medical Association and its joint initiative to build a community of greater support for LGBTQ and allied physicians in Minnesota. So hopefully many of you in this room who are physicians or aspiring physicians will get connected to this work, and we'll see you at more events just like this. Well, I'm beyond thrilled to have Dr. Ehrenfeld here today. As you could tell from the resume and the background, just the incredible work, and now having someone with your background and experience leading the American Medical Association and here today in Minnesota, we're just thrilled. So on behalf of the whole Rainbow Health family, thank you for taking time out of your busy schedule and your family to be with us today.
Thank you for having me. It's a treat to be here, and when I got the invitation to visit with all of you, I told my scheduling team that no matter what it took, I wanted to be here with all of you in Minneapolis and Twin Cities. And I have to just make note, the announcement of this new committee, it's a big deal. And when I was a resident in Massachusetts, I asked, does any state medical society have a committee like that worked on our issues? And the answer was no. And I said, well, we need one. And so I wrote a resolution to create one. And it passed, and we created it. And then I was pulled aside and told, well, that's fine, but this is it for you. That's going to be the end of your career in organized medicine, because it just didn't sit well with everybody. Well, here we are today.
Well, I'd like to start out. Obviously, we've all been watching with horror and disgust to see the kind of attacks across our country on LGBTQ and specifically transgender and gender-affirming care in America right now. And it was so heartening to see the American Medical Association consistently take such solid stands in defense and support of transgender health care and access to gender-affirming care. And I know moving large organizations like that is not always easy. And so just talk about your role as the AMA president and working with the AMA. What do you think, what motivated the AMA and what was behind the push for AMA to stand out so clearly and so strongly at a time we needed it?
Yeah, I mean, for as much progress as we had been making in society around acceptance and inclusion, it was clear to the AMA and all of us in leadership that we still have tremendous stigma and discrimination in healthcare. And I will tell you, I get calls to my office every week from a patient who has been turned away, told we can't care for you, we won't care for you, we don't know how to care for you, members of the LGBTQ plus community. And that happens, and it shouldn't happen, and we know it shouldn't happen. And so we need to make sure that we have strong policies that can prevent discrimination. We know that we need to have physicians who have the capabilities and the skill sets to deliver the care. And we need to change society to be more accepting. And so all of those things coming together have really drawn the AMA into this space where we know, as the most influential, the oldest association of physicians across the country, we have such a critical and important role to play. And especially given what's happening in society now, it's more important than ever.
Well, and building on that voice, one of the things we're paying attention to and are afraid of is the potential federal ban on gender-affirming care. Yeah. As a voice in Washington on behalf of physicians around the country, what are some things the AMA is doing to prepare for the possibility of a fight for a federal ban on gender-affirming care?
Well, we're in a law school here, so what do? We hire lawyers. No, in all seriousness, we have been very active in numerous cases around the country, joining with many partners to file amicus briefs, in some cases to file suit primarily against these discriminatory laws and bans and anything that is preventing patients from getting the care that they need. A primary partner for us on many of the laws that are targeting children, minors, transgender kids, has been the American Academy of Pediatrics, and they have been steadfast in their support of our positions, which is that parents and families ought to be making decisions without a politician inviting themselves into the exam room. And so we continue to file lawsuits and amicus briefs. We continue to send lots of letters to legislators and attorneys, or state attorney generals, as well as governors. And we will continue to make sure that we have people know that our voice is there. I will say we have had mixed success. So the Eastern U.S. District Court in Arkansas in 2021 made a very favorable ruling that basically vacated a ban on care for transgender kids in Arkansas based on the 14th Amendment Equal Protection Clause. And it was really interesting. If you read the judge's ruling, they basically said two things. One, the state's experts were completely uncredible, and they weren't. They were not experts. And two, the evidence was clear, that when we provide gender-affirming care for children and adults, people do better. And that's what this is all about.
Well, as we know, working on these issues, filing lawsuits and advancing legislation is one thing. Education and helping people understand what gender-affirming care is, why people need it, is as important. And I know in Minnesota, the laws that we have passed have come about because people in the community and our advocates and allies took time to educate lawmakers, educate allies, and educate the public. So can you talk a little bit about things that the AMA is doing to educate physicians around the country, lawmakers, and even the broader public around LGBTQ healthcare?
Yeah, absolutely. So, education of physicians and students and trainees is basically in our sweet spot. And the AMA has taken this wholeheartedly. We have a really wonderful foundation. And I'm very proud that the foundation, which does have its own independent board, although there is shared leadership, decided a few years ago that it was time to start funding and creating LGBTQ health fellowships around the country. And so we now have a growing number of these very specific training programs in places like Wisconsin and Tennessee and New York and California, and the whole idea is that they grow and multiply. Now, we know that that doesn't solve the problem for all the people in practice today. And so making sure that we leverage our channels, and the AMA does a lot of things, and I'm sure that for the non-physicians in the audience, you probably don't know a whole lot about the AMA. It is a household name. You've probably heard of it. But you've probably also heard of JAMA, the Journal of the American Medical Association, one of the world's most widely cited, widely read medical publications that has tremendous influence on how medicine is practiced. And we've been able to use JAMA, the JAMA network, in our education hub, which is a place where all of that content lives, to educate physicians about LGBTQ health, to raise the competency across the country. And so 10 years ago, if you searched any of the words in LGBTQ+, in our online portal where people go, and literally thousands and thousands of people every day are accessing this content, you have found absolutely nothing. I am proud to report today that if you go and search for gay, lesbian, transgender, gender, non-conforming, queer, you will find a lot of content. And we have brought in incredible partners, Howard Brown, Fenway Health, national experts to help us develop that content and then push it out so that not only do we start to work on folks who are in medical schools, not only do we start to work for folks who are in their residency and fellowship training, but we can try to get that content out to practicing physicians across the country. And There was a really interesting survey published in JAMA when I was a resident that did a survey of the 125 or so medical schools at the time about how much curricular time was devoted to LGBT health, and the average was an hour. An hour in a 4-year curriculum. That has changed markedly because of advocacy, because of curricular requirements, and because we now have content that's freely available and people are able to push out.
Well, we would love to be on that list with Fenway and Howard Brown, and I'll note in our packets today is just a little bit of the information in the Voices of Health survey that we do here in Minnesota for more than a decade on the health
That's
needs
great.
And health barriers for LGBTQ Minnesotans. So we'll add that to our to-do list.
And I will say, we do have a bit of a dual issue here, and a lot of this comes back to stigma, right? So there's a lot of reluctance on behalf of patients to come out to your healthcare team and your physician, and I understand that because there's a lot of mistreatment and harassment, and so people choose not to share their orientation or their identity with their physician or their healthcare team. The challenge is, as I think probably everybody sitting in this room knows because of the reason that we're here today, it matters, right? The healthcare recommendations differ based on your orientation, your identity, and your behavior. And we cannot deliver the best care if we don't know who the patient is, if we don't know who the patient's family and social situation are. And yet a lot of physicians are still reluctant to ask these questions because they're afraid that they're going to offend somebody. It turns out there's really clear data. One of the best studies on this actually was done by the team at Fenway Health. They surveyed patients of all types at a bunch of fairly qualified health centers. And my favorite was the one from a rural health clinic in the middle of the South where they asked patients, do you mind if your doctor asks you about your sexual orientation or gender identity? And nobody cares. Because people know that in a healthcare context, you're not asking these questions because you're curious. You're asking these questions because they matter. And you're not going to offend grandma. Go ahead and ask the question.
Well, Minnesota, as you may know, is proud to be a state where our governor, our legislature, the mayor of Minneapolis, many levels of government have declared in state law now, Minnesota is a refuge for transgender individuals, their families, to seek the kind of care that they need. So we're trying to do everything we can here in Minnesota to be a refuge and a beacon. But that has been in response to the disaster of what we see around half the country.
22 states.
Where all
And
the
counting.
states are doing that.
Yeah.
And so you mentioned this earlier in your opening comments, but in addition to leading the AMA, you're a physician, and you talk to physicians and you care a lot about healthcare around the country. Could you talk a little bit about, I'll say damage, but at least the effect that these bans and this whole negative debate has already had on the healthcare system that we're going to need to rebuild and fix and repair before we get things back? So just talk a little bit about the impact that you see that this conversation and the laws have had on healthcare in America.
So there's the very direct impact. And so when I was in Nashville for 9 years, I set up the LGBTQ health program at Vanderbilt, which transformed how we delivered gender-affirming care in the Southeast. 3 surgical clinics, medical clinic, the whole thing sprung up. That's all been erased. And watching my colleagues have to detransition patients off of hormones was horrible. And I can't even imagine the pain that has caused so many of those patients who came to us, relied on us for care that they could no longer provide. One of the most wonderful, affirming, caring physicians who I have ever met, who I personally recruited to run that clinic, 2 weeks ago, I was watching her post pictures online, hugging her family, her friends, her colleagues, goodbye, to move to a different state. Because she can't, in her heart of hearts, practice in an environment where she can't do the right thing for her patients anymore. And so a lot of physicians are facing this challenge now, whether it's related to bans on gender-affirming care or abortion and reproductive health care services, with this real struggle. How do you rectify this duty to patients, duty to the ethics of the profession to practice evidence-based medicine, and the legal restrictions that you suddenly are facing under. It's not an easy equation, and a lot of people are struggling with that. So there's that aspect. The other component of this that I think is deeply damaging, and we talk a lot about the social determinants of health, and I'm sure you all know what they are: housing, stability, access to healthy foods, all of those kinds of things that drive whether people are healthy or not. One of the most important drivers of the social determinants of health is stigma. And there is very clear evidence for this, and they're wonderful studies. These are hard studies to do, by the way, but they're really good, that show that the policy environment that you live in actually drives health because it drives stigma. And the first studies on this were actually, there was this funny natural experiment that happened with marriage equality, when states either allowed same-sex marriage or banned same-sex marriage. And so we had people living in states where the policy environment was markedly different. And so some very smart social scientists with health services researchers were able to actually look at the experience of LGBT plus people living in these states with different policy environments. And they were able to adjust for all the factors and tease out that actually your health matters if the government is discriminating against you, whether it actually impacts if you can access care or not. So if you live in a place where the legislature says you are different and you don't matter and you shouldn't have access to the same things as everybody else, that weighs on people. And we know that that actually has a long-standing impact on people's health. And so it's not just, can you actually access the care? There's this other weight that has a really devastating impact on people.
Yeah. And we have seen that in Minnesota also, even though we haven't had the kind of vitriolic rhetoric to the same degree here. Our young people and everyone in Minnesota still reads the same news and hears the same headlines. And one of the most shocking, I wouldn't say shocking, results of our most recent Voices of Health survey was that 6 out of 7 LGBTQ Minnesotans experience moderate to severe mental distress on an almost daily basis. 6 out of 7 LGBTQ Minnesotans in the last year of our survey experienced moderate to severe mental distress. And that is higher, obviously, in previous years. And so even in a state like Minnesota, we have to recognize that this broader debate has an impact here.
Yeah. And unfortunately, there's been nothing good about COVID, except that we figured out how to do mRNA vaccines. It's been terrible. Millions of people lost their lives worldwide. So much pain. But the lasting legacy of COVID-19 is this misinformation problem that's not going away anytime soon. And that has fueled this very dangerous, heated, divisive rhetoric around anti-trans legislation that now is being picked up in so many jurisdictions around the country. And I don't see a solution to this in the foreseeable future. And I'm trying not to be too pessimistic, but I feel like as we get into the next election cycle coming in calendar year 2024, it's only going to get worse.
The new Speaker of the House, the likely Republican presidential candidate, I think your prediction is right. Now, you mentioned your personal experience with Vanderbilt and other positions around the country. Can you talk about what you personally and what the AMA are doing to help support LGBTQ physicians around the country?
Yeah, so a big piece of what we have tried to do is first understand the need and then try to support physicians across the community. And for me, it starts with data, right? If you don't know who your audience is and what's happening to them, how on earth can you try to support the needs? And so it's only a relatively recent change that the AMA started collecting sexual orientation and gender identity data on our members. It's like an obvious thing to do, but we had never done it until finally our LGBTQ advisory committee said, we need to do this. We need to know the experience of our members. We need to know what's happening to LGBTQ plus physicians across the country. So that's been a really important tool to help us then develop the resources to support people in practice. And it's a slightly different mission than trying to make sure that people can provide high-quality, competent care to the community. There's also special needs of that group. And the AMA, actually, it's a funny story. I'll tell it. So somebody in my seat years ago, an AMA president, was doing an interview. And he got the talking point right. But that darn reporter just kept pushing him and just kept pushing him. And he should have just stopped talking, but he didn't. And slipped out that it was okay for a medical school in upstate New York to discriminate against an LGBT student group because they were a private school, which was not the talking point. It was not our policy, but that is what he said. It was the wrong thing to say. It got cleaned up a little bit later after a lot of outrage and anger, which was appropriate. And the result of that was the AMA board at the time said, you know what, we have a blind spot actually on these issues, and we need to do better. And so that actually led to the creation of an LGBTQ plus advisory committee for the AMA Board of Trustees that exists today and has been incredibly helpful and effective in guiding the association and helping us with our policy and helping us with language to make sure that we're getting it right.
We want to bring everyone else into this conversation as well. So if you have a burning question, think about it. And we have a roving mic. So start thinking about your questions, and we will get to audience participation in a minute. I want to change focus a little bit because we've talked a lot about LGBTQ and gender-affirming care, but certainly at Rainbow Health and many people in this room understand that you mentioned social determinants of health, that a lot of the challenges and disparities in LGBTQ populations are driven as much by race and gender and economics as it is about gender identity and sexual orientation.
Right.
So wondering if you can talk a little bit about what the AMA is doing to address racism in the medical systems and in healthcare in America.
Yeah, so it starts by declaring racism a public health threat and crisis, which we have done. And in 2019, we actually recruited a transformational leader named Dr. Letha Maybank. She was the Deputy Commissioner of Health in New York City. And she is the founding director of the AMA Center for Health Equity. That group has exploded. We have hired a ton of folks to support that work. And in 2021, we released a very aggressive, groundbreaking strategic plan to advance health equity. It's available on our website. It is 86 pages. It has an executive summary that's one page that you can look at. But it talks about how do we make sure that we embed equity in everything that we do across every business unit as an association. And the AMA is big. We've got 1,000 employees in Chicago, 100 in DC, all doing various different things. We need to make sure that everything is viewed from an equity lens. How do we make sure that we share power with those who have not held it in the past? How do we make sure that we go through a process of understanding what is truth and go through a reconciliation and healing activity? And we actually now have a national task force that is going to be working through that for a 2-year process for us. The other piece of that document that was really important was a reckoning of where we had been. And the AMA is 177 years old. I'm the 178th president. I don't know why there's an extra president off the years, but I don't know, maybe someone got sick. And, you know, when you have an organization that's been around since 1847, there's a lot that went wrong. And in that document are a set of appendices that talk about all of the missteps and all of the moments where we could have been inclusive, but we said, no, we're not going to allow black physicians to join the AMA. Where we could have stood up against conversion therapy, but we said, no, it's okay, we'll just defer to other organizations. And so that accounting of those lost opportunities or those active maneuvers that have caused harm and pain, it's all there. And to acknowledge that, to own that, is a critically important first step as we think about what that intentional future can be. So I'm very proud to be at the helm of an organization that is taking this step. I will tell you, one of the things that we did which was a huge investment of time and energy, was for every employee across our association. We had them go through a 2-day-long intensive facilitated conversation with Race Forward, which is a wonderful organization that does trainings, to get everybody on the same page in terms of language and understanding of what we're talking about when it comes to social determinants of health. And so from our CEO all the way through all of our leaders, all of our frontline employees, even the folks who open the mail, everybody went through that. And it's been a really incredible process to see the kind of transformation that has caused. And I'm grateful that we have a board and a CEO that are so deeply committed to it.
One follow-up, and then we'll take questions from the audience, so if anybody is ready to ask. And it kind of builds on that, but one of the things that we see a lot at Rainbow Health is folks who just don't even have access or affordable access to basic health care and health insurance. And as complicated as health policy is, and not to go too deep into that whole debate, but just want to talk a little bit about the AMA stance and what you're doing to make general health care and health insurance more accessible to more people in America.
Yeah, it's a top priority for us to make sure that everybody in America has access to care, period, full stop. We supported the Affordable Care Act. We took a lot of heat for supporting the Affordable Care Act. It was the absolute right thing to do. The Affordable Care Act is not perfect. There are huge gaps, and we have 11 states, including my own Wisconsin, that have not expanded Medicaid. And that causes all sorts of problems as we think about those gaps in coverage. So we continue to push for congressional action to enhance the Affordable Care Act. Certainly we got a lot of support through COVID flexibility and additional dollars that helped get people into care, get people access to services. But we know that healthcare is not affordable, it is not accessible, and we have a whole series of policy priorities that we're trying to work on both at the state and the federal level to change that.
Rick Kutcher is our aging services advocate at Rainbow Health, and so Rick, looks like we have a question down here.
Thanks, Rick. And thank you very much for so much information, and to hear that you're moving the AMA, if I don't move the microphone. Am I touching something? No, it's just okay. Oh, all right. You're moving the AMA forward on such important areas, race, and of course the GLBT issues that many of us deal with on a daily basis. Today I've heard from presenters and from people in the audience, and the topic has come up about surgeries that people undergo in order to become whom they truly are, and surgeries, unfortunately, that babies have undergone, or young children who were born intersex, because physicians didn't understand the full magnitude of the social and medical implications for the children. And it made me think about a New York Times article last week about sex and sexuality and healthcare for people over 60, and specifically it talked about women, including cis women, who have undergone medical procedures to the genitals by physicians who don't know the anatomy, don't know the neurology of it, the nerve endings, and have done harm. And I've been thinking this last week, where can it start in terms of research on the clitoris and the surrounding tissues and how sensitive it is? So I wanted to bring that up just because so many of us are women, and are affected by the lack of knowledge that many of our providers have.
Well, I will be the first to admit I am not an expert in the clitoris. But I do know that it's an important structure. We generally defer to our specialty societies as they try to understand the evidence and evolve clinical practice. And our position is that we ought to follow the evidence, and we should never be afraid as science changes. And that was one thing that hurt us during the pandemic. And I'll tell you, my husband, who is amazing, by the way, I have 2 children, 9 months, 4.5. The fact that I'm here dressed in the right spot is all because of him. But he was the attorney who approved for the county, works for county government, all of the reopening plans. You know, when we had reopening plans, you could do this, you can do this, and whatever. And his office got really mad. They're like, God darn it, why do they keep changing the rules? And he's like, well, because the science is changing. We're learning every week more about this virus and how to keep people safe and what we can and can't do. And that's just frustrated people. And I get that created just a whole communications challenge that, you know, you can argue whether it was handled appropriately or not. You know, it's done. But wherever the science is, whatever it takes us around these challenging issues around folks who have differences of sex development or the clitoris, we shouldn't be afraid, right, to follow the science and make sure that we understand that we're always doing what's in our patient's best interest. You know, I think a lot of these issues, and whether it's LGBTQ health or at large, you know, we need to make sure that we have funding and resources and support and people to do it. And I will tell you, it's been interesting watching the children's hospitals, right? So, you know, who doesn't love a good children's hospital, right? They do all this great, you know, they get lots of money, great fundraising. You know, everybody feels warm and fuzzy about their children's hospital. And then they're suddenly in the crosshairs of the attack on gender-affirming care for kids. And it's been really interesting to watch which institutions have stood forward and said, no, we're going to speak out against these reprehensible laws, and which have kind of quietly just stood back and waited for somebody else to step up and step forward. And I will tell you, you know, there's a major center in Chicago, Children's Hospital. They have a huge research program. It is really important and has been foundational in defining care pathways for trans kids. And they have said, this is an existential threat to our identity, who we are, our research programs, our clinical services, if we don't speak out against these reprehensible laws. Now, fortunately, Illinois is not a state that has taken action, but they've been very vocal and very active. And if we stop doing the research, right, then that just is another way that we attack science.
Yes, hello. Oh, it's so loud. Hi, I'm July. I am the founder of Minnesota's only trans-owned hair removal business. We specialize specifically in medically necessary hair removal in preparation for gender-affirming surgeries. Medically necessary hair removal, gender-affirming surgeries. We're building the nation's first all-trans electrolysis training institute. We'll bring trans folks in from around the country. We'll train them not only in electrolysis, but the specialized equipment that we use, the pathways that we pursue to have insurance contracts, the ways that we build a professional network. And I was touched by your mention of shifting power. Shifting power is at the crux of what the vision is as an all-trans. We're collectivizing at the end of the year. We're growing from a team of 2 to a team of 6. Will be owned and operated, all trans, all dolls. And we have a specific vision right now to purchase a building. This building has 19 spaces, and we only need 6. The other 13 are rented out to whomever. But by purchasing this building, there will be then the opportunity to move other trans providers in one at a time as the current tenants move out. We'll build an infrastructure for helping emergent trans providers to have infrastructural support for their business so that they're ready to move in as spaces become available. And so I guess my question is, what does shifting power look like? What what does shifting
Yeah.
power look like? Where is nimble money? Where is the way
Yep.
that we can, as trans people who don't have access to these spaces, continue to exist in our communities, but bring the resource to us?
So the best, most concrete example I can give in terms of supporting what I would describe as entrepreneurial activities like that is around social impact investing. And the AMA has taken that on with partners in our hometown of Chicago. Some of you may know geography of Chicago. You know, it's lovely like Michigan Avenue and the Gold Coast where all the stores are. And then you go 2 miles west, and because of redlining and disinvestment, you have communities where the life expectancy is 10 to 15 years lower. And so there is an incredible coalition of organizations backstopped by one of the health systems that has pooled capital. And they have invested $157 million or something like that at this point into doing community-based work to refresh the housing stock, create zero-interest loan opportunities for entrepreneurs to set up new businesses, to try to create healthcare access for people who may have insurance but they can't afford the co-pays, or they have the deductible gap for their pharmaceuticals, to make sure that people are healthy. Those kinds of models, and there's one in Atlanta, I'm hoping I can create one in Wisconsin, haven't hit specifically our community, but they should. And I was at the Association of LGBTQ plus corporate directors 2 weeks ago in New York. Who knew there was such a thing? It's new. They actually got to ring the closing bell at NASDAQ, and their mission is twofold. One, to get LGBTQ people on public boards so that our voice is there and we can share that power. So 0.5% of board seats for NASDAQ, New York Stock Exchange companies are held by LGBTQ plus people. 0.5%. Got some work to do, right? And there are now venture capital firms specifically investing and specifically having a portfolio around LGBTQ health business investment. So I'm optimistic that we'll see more in this space, but it clearly hasn't been what it needs to be.
Thank you.
I don't need electrolysis, but when you get your building up, let me know and I'll come visit.
Hello, I'm so happy you're here. My name is Sharon Preeves. I'm a medical sociologist, and I do work with and about intersex health equity and bodily autonomy. And I'm wondering, with respect to the LGBTQ work that the AMA is doing, where intersex fits in or doesn't.
So in general, we think of the intersex work as separate from the LGBTQ health work. There are places where there is overlap because of some of the policy considerations. We have separate policies around patients with differences of sex development. And I haven't seen it, but I know HHS actually made a pretty significant announcement this past week. They told me they were going to make the announcement because I was with Admiral Levine a week ago, but I haven't seen it. So I need to find out what the feds have done to try to advance the conversation and make sure that we are not causing harm.
Hi, I was just listening to your statistics about the Medical Association earlier, and personally I'm autistic and disabled, and my best providers are neuroqueer who run on spoon theory. They understand that there are extra costs and extra time it takes you in your life. And I was just wondering, are you tracking statistics of dropout rates from applicants to medical school, and how are you supporting those intersectional providers who are genderqueer and neuroqueer and or disabled, plus come from other intersectional populations? Because those are the best providers usually that you need to be asking the right questions for research, because they experience the world differently. And if they aren't leading the research projects, the right research doesn't happen. Right now, for autistic research, you need to go to Australia, New Zealand, Canada, and Europe to look for papers, because providers in America really aren't driving that. And I see the same for other intersectional gender health and other issues. So how are you moving power? Like, I don't have words for building that community project. Moving power in health research so that those leaders are leading the way, or you're supporting their vision for projects.
Yeah, all great questions. On the first question, which was about tracking, who's getting to medical school, who's staying in medical school, who's getting through medical school, those data actually are tracked by the AAMC, which is the Association of American Medical Colleges. And fortunately, but only recently, did they start asking questions on application forms about sexual orientation and gender identity, optional questions, so that we know who's applying and who's getting in. But we haven't been able to longitudinally track that, along with disability status, as well as race and ethnicity, because we've never had that data. So that is relatively new. And I don't actually know if they've done sort of the kind of crosstab analysis that you've described, but I can certainly find out. In terms of the research, I would say that a foundational shift, at least within the federal government, which funds a bulk of research. It's actually not the majority of research, because the majority of research is funded by pharma. Different conversation for different day. But at least federally sponsored research took an important shift with the creation of the Patient-Centered Outcomes Research Institute, which was part of the Affordable Care Act. And the whole concept there is that patient needs and patient voices need to drive clinical trials and clinical research. Now, has that been completely effective? No. Has it moved the needle? Absolutely. And we could give you lots of examples of where that has occurred. I can't speak though specifically to questions about the research in autism now.
Can you hear me? Oh, okay.
Hi, my name is Karen Stricker. I'm an example that you can transgender and be on the spectrum. Different therapists though. I just saw a statistic from the OECD in regard to, medical statistics, and within that group of nations, the US is the most dangerous part to give birth, and especially if you are black or Native American.
Yeah.
So you were talking about all the actions that you had to fight that. When do you think that this will actually start improve the situation?
Yeah, the maternal mortality and infant mortality statistics are shocking. In Milwaukee, black mothers die at 3 times the rate as white mothers in childbirth. Black babies die at 15 times the rate of white babies in their first year of life. It's not biology that's driving this. It's racism. We know that. It's people not being listened to when they are in crisis. It's people not having access to the care that we know can prevent these preventable, horrific outcomes. So as we look at our overall framework around creating health equity, dealing with structural racism is a foundational component of that. And until, as a nation, we can deal with structural racism and discrimination, I don't think we're going to see tremendous movement. So we will certainly do everything that we can as an association in healthcare settings to do our part, but you've got to recognize the context that we all live in. And I'd love to say I think things are getting better, but it's been a rough couple months.
We have time for one more question, and then I think Dr. Ehrenfeld will still be around for a little bit if you want to ask questions afterwards, but we want to keep on schedule today. So our last question from the audience.
Hi, Dr. Ehrenfeld. Thank you very much for taking my question. My name is Dee. I have the privilege of working for a trans physician at a venture capital-backed telemedicine company that's entirely dedicated to providing gender-affirming care. We serve about 13,000 patients nationally, and as you can imagine, the past year has been pretty rough, and very grateful for all of the AMA's comments affirming gender-affirming care. My question to you is, in states like Florida, for example, we have actually provided testimony to the Florida Board of Medicine on the fact that gender-affirming care is recognized by the AMA, and it's a part of WPATH and standards of care. And my question for you is, what influence does the AMA have with local boards of medicine? Because it just blows my mind that the biggest challenge that we seem to face is from local boards that are trying to rewrite the rules, which are actually not based on medicine or science.
So I'll tell you how it works. And I was on the phone with the Florida Board of Medicine chair having a very awkward conversation about what they have done and are planning to do that did not go well. We are the national association, and there are 190 state and specialty societies that are part of the federation, including the Minnesota Medical Association. Many times, a state will be facing something, a proposed rule or law, and they will call us. And then I will fly to a state capital, and I will meet with legislators, the health board chair, whoever it is, to share our perspective, our policy, the evidence. And then sometimes the state tells us, actually, people in our state don't really like the national organization showing up. And so in some circumstances, actually, us going into a state is counterproductive. And so we really rely on our state partners to help us navigate that. But we really rarely go into a jurisdiction, a state, a locality, without an invitation from the state association. So those partnerships are absolutely critical. I spent a lot of time with my colleagues in Florida this past week having these conversations, and obviously that is a particularly challenging policy environment right now. Thanks for that great question.
We've talked about a lot of progress that has been made, and those of you who have been doing this work for a long time recognize that a lot of progress has been made on these health issues. At the same time, these are dark days, and this is really difficult work. And so I kind of want to end a little bit on a positive note and just talk about hope and what brings you hope, because the folks in this room are by and far advocates who are doing this work, and we have good days and bad days. I've been reading an autobiography by Bob Dylan right now, and one of the phrases he uses a lot in this book, that the only way out is through. And so it made me think about this time right now, that the only way out of this is just by doing the work and standing up every time that we need to stand up. And so just want to give you a chance to talk a little bit about, in these conversations you have in Florida and the work that you're doing around the country, what gives you hope and optimism to keep it up?
So there are two things. One is, in spite of all of the pressure and the challenges, the physician community continues to show up, right? And I will go into the hospital on Monday, and I will see my colleagues that in spite of all of these challenges, they continue to be there for their patients, and we continue to attract incredible talent into healthcare, and I am grateful for that, and that will not go away. Organizations can change. The AMA has changed. When I showed up as a first-year medical student in 2000, 2001, the conversations, the debates that I heard were jarring. The arguments against inclusivity, the homophobic comments against our community were shocking. And I remember stepping back and thinking, is this ever going to be a place for me? Fast forward 10 years, the AMA finally started to step forward and to support our community in earnest. in powerful ways that have made a difference. One of the first policy debates that I got very involved in was around trying to end the ban on blood donation for gay men. A policy rooted in stigma, a policy that did not make scientific sense, a policy that was a legacy that the FDA and the CDC would not change. And so it took almost 10 years to get the AMA to oppose that policy, and then almost another 10 years for the AMA and other partners to finally this summer get a policy change from the FDA. And so in September, last month, my husband and I, for the first time in our lives, had the opportunity to go to our local blood center and donate blood. And that moment brought me to tears. And those moments are the ones that in these dark days give me hope.
Well, thank you. On behalf of Rainbow Health, all of us here in Minnesota, thank you so much for the work that you're doing and leading the AMA. Thank you to the AMA for the sea change it has made and the work that it's doing around the country. We need as many allies, as many champions as we can get. So thank you, and thank you for spending time with us today. Another hand for Dr. Ehrenfeld.
Thank you. Thank you very much. This is great. Thank you. Thank you.